The location of the finish lines of a preparation in relation to the gingiva is important to the longevity of the restored tooth. Extension of finish lines apical to the crest of the gingiva may cause trauma to the periodontal tissues. Discrepancy or roughness of the margins may cause chronic irritation to the soft tissues. This irritation can lead to destruction of the supporting structures of the tooth and eventual tooth loss. Preparation trauma and irritation to the soft tissues can be avoided by locating the finish lines of crown preparations incisal or occlusal to the crest of the gingiva, or supragingival. This location of the gingival finish lines also facilitates the preparation of the finish lines, the taking of impressions, and the final adaptation of the restoration. Supragingival location is the optimal, especially for patients with signs of periodontal disease, such as recession of the gingiva. However, before supragingival location of the finish lines is decided upon, the following factors must be considered. 1. The aesthetic demands of the restoration. 2. The retentive qualities of the preparation. 3. The condition of the tooth structure at the cervical third of the tooth, and 4. The contours needed in the crown. In the anterior region of the mouth, the labial or buccal gingival finish lines of preparations for porcelain crowns and gold crowns with porcelain should be placed subgingival. Location of these finish lines apical to the crest of the gingiva places the demarcation line between the restoration and the tooth out of sight in the gingival sulcus. Should the crown preparation end up too short for sufficient retention of the restoration, due to overzealous tooth reduction or necessary removal of caries, the gingival finish lines must be placed subgingival, to obtain all possible length to the axial walls of the preparation. When defects or restorations are present at the cervical third of the tooth, it is advisable to extend the finish lines of crown preparation subgingival, or apical to the defect or restoration. Subgingival placement of finish lines is necessary in most crown preparations for teeth that are to be used as abutments for removable partial dentures. The subgingival finish lines establish the necessary clearance for precise contouring of the crown, to fulfill the demands placed upon it for support of the removable partial denture.